Hello everyone, Dr. Jesse Houghton here, gastroenterologist, board certified in both gastroenterology and internal medicine, author of the brand new book, What Your Doctor Doesn't Have the Time to Tell You, The Gastrointestinal System. The book comes out on May 18th, although you can pre-order the ebook version on Amazon at the following address. The book covers all major gastrointestinal conditions, from acid reflux to constipation and everything in between. So let's take a topic covered in the book, diverticulosis. You may have heard of this condition but are not exactly sure what it is. People often get confused between diverticulosis and diverticulitis. Diverticulosis is when people have pockets in the wall of their colon. They are usually located in the sigmoid colon, which would be your left lower abdomen. They are commonly found on CAT scans of the abdomen and can also be seen when you have a colonoscopy. They usually do not cause problems. In fact, millions of people have diverticulosis and most will not have any complications from it. Diverticulosis, however, can cause occasional lower abdominal cramping, but this is not something to be overly concerned about. Diverticulitis, on the other hand, is when one of these pockets becomes infected. Typical symptoms include pretty severe left lower abdominal pain, fevers, chills, and often a change in bowel habits. Usually constipation occurs from the swelling in this area. We usually treat a bout of diverticulitis with antibiotics, most often Cipro and Flagyl. A liquid diet is often recommended for a couple days, followed by a low-fiber diet for a couple of weeks or so. Now, once a patient is back to normal and feeling better, we recommend a high-fiber diet long-term. Although there are certain risk factors for diverticulitis, namely smoking, obesity, NSAID use, we really don't know why certain people get diverticulitis and others do not. That brings me to the potentially confusing topic of nuts, seeds, and popcorn. I know many of you have heard that if you have diverticulosis or have had a bout of prior diverticulitis, that you cannot and should not eat these foods. Well, I'm here to tell you that the data and the studies that we have show us that eating these types of foods do not cause diverticulitis. I know that may sound blasphemous, but it's true. In fact, these types of foods have been shown to be protective of diverticulitis, if anything. Now, I do have patients that tell me when they eat a bag of popcorn or a jar of nuts that they get lower abdominal pain. And I believe this is true. These foods can be somewhat hard to digest, and so that is the likely cause of this pain. But it should not be causing actual diverticulitis. That said, I don't push my patients to eat these foods if they are concerned about this risk. I simply provide the data that we have. Well, that's it for this topic. Tune in later for more GI topics from the book. And if you have any questions, please email me at info@gastrodoc1.com. That's info@gastrodoc1.com. Be well, everyone.